Good morning, all. I'm very, very pleased to be here with you this morning to announce the St. Louis Metropolitan Pandemic Task Force. This is representative of the unprecedented collaboration that has gone on over the last few weeks between and among the group of people that you see here and others who have been involved as well. I'm Lyda Krewson. Of course, I'm honored to be here with you today. Before we begin, I'd like to take just a minute to introduce some of the other folks who are here with me today. St. Louis County Executive Dr. Sam Page, St. Charles County Executive Steve Ehlmann, Franklin County Presiding Commissioner Tim Brinker, Jefferson County Executive Dennis Gannon, Director of the City of St. Louis Department of Health Dr. Fred Eccles, St. Louis County Public Health Director Spring Schmidt, St. Charles County Public Health Director Demetrius Cincy Chapman, BJC Care Chief Medical Officer Dr. Clay Dunnigan, Mercy Chief Quality Officer Dr. Keith Starkey, and SSM Health Chief Medical Officer Dr. Alex Garza. We are all here today because we need all of the people of our region to understand this unprecedented time that we are in. The COVID-19 pandemic is a deadly serious situation right now. The next 2 weeks are going to be absolutely critical. We each have to do our part to stop the spread so our health systems can do their job of saving lives. We have outstanding world-class healthcare system here in our region. But if this virus spreads too fast, our healthcare system, its workers, and their equipment could be overwhelmed. Over the past few weeks, you've seen us act collectively as a region, taking unprecedented and appropriate action early to get ahead of this. We've issued mandatory stay-at-home orders. We've restricted bars and restaurants to carry out only. Schools have been closed, casinos are closed, and we've prohibited any gatherings more than 10 people. All of that preemption action has been vital to where we are today. But we need all of you, all across our metropolitan area, to continue to take this seriously. We all must comply with our stay-at-home order. We all must stay home as much as we possibly can. We must do our part to help us slow the spread of COVID-19. Our behavior is the only thing that we have to slow the spread of COVID-19. There is no shot, there is no pill, there is no medicine. It's just our behavior. I want to thank you all for taking this seriously as I do, and really want to thank all of the residents and the businesses of our region for acting in good faith on everyone's behalf. Thank you so much. County Executive Steve Ehlmann.
Thank you, Mayor. To begin with, I just want to make one thing clear, and that is what we're doing today is really formalizing a relationship that started to develop almost a month ago. The leaders you see here, as well as the professionals, have been communicating on this thing for a long time, and we've been working together. We're sort of formalizing that relationship at this time. I want to thank the media for helping us get this word out. As the mayor suggested, it's our behaviors that are going to make the difference, and people are not going to know how to behave just because we write an order and put it out. They need you to keep telling them what the rules are and how important it is that they continue to do the social distancing, to observe the various orders that are in effect. And one of the problems that Executive Gannon and Presiding Commissioner Brinker and myself one of the problems we've had the last 3 or 4 weeks is Jefferson, Franklin, and St. Charles County have not had as many cases. But last week we did some research in our department, and what we discovered, what we did was to plot the growth curve for this virus. And sure enough, there were more cases in St. Louis City and County, but the growth curve was the same. And if you took that graph and you moved St. Charles, Franklin, and Jefferson County back 6 days, or ahead 6 days, depending on how you look at it, the growth curves are identical in all 5 of these jurisdictions. So this is just as big a problem in St. Charles, Franklin, and Jefferson as it is or has been in St. Louis City and County. We're just about 6 days behind. And I would suggest probably when you go out a little bit further to Lincoln, Warren, St. Francis, St. Genevieve County, they may be 12 days behind, and the state's not far behind them. So that's why I want to thank the governor for doing what he did yesterday and recognizing the fact that even though in outstate Missouri may not look as bad right now, it is potentially as bad if we don't do the things that need to be done. So again, thanks to all my colleagues and to you and the professionals that have been working so hard and have a real challenge ahead. Thanks. Dr. Sam Page, St. Louis County.
Good morning, everyone. 4 weeks ago today, St. Louis County had its first COVID-19 patient in the state. And today, St. Louis County has the most people tested and the most who have tested positive. Our response has been aggressive. We've required social distancing. We restricted restaurant service to take out and carry out. We prohibited non-essential activities. And we followed the data. Consider this, since the stay-at-home order, travel in St. Louis County is down considerably, but travel in parks is up 87%. As a result, the parks were increasingly crowded, and people were not following common sense social distancing practices. Too many people were being put at risk. So this week, we temporarily closed our parks, and it was a hard decision. I didn't want to close them, but that's where the data led us, and it was the right thing to do. Through it all, our public health officials have kept in touch with other regional agencies and our local hospital systems. Our hospital systems are first rate, and the standard of care they provide is superior. But there are several hospital systems in the St. Louis area, and coordinating them is no easy task. So I'm encouraged today by the announcement that they have appointed Dr. Alex Garza to coordinate their services. I've known Dr. Garza for several years. We've worked together in the past, and we will work together well now. In addition to coordinating their effort, Dr. Garza will also provide our public health officials with a single point of contact. Each part of our region has different public health needs, and the local governments may address these challenges slightly differently. But delivery of health care is consistent. By having a single point of contact, our hospital systems will ensure that that level of service is consistent throughout the region. As an anesthesiologist, I understand how coordination is important in the practice of medicine, and I am confident that Dr. Garza will bring us that level of service and that constant point of contact so we will all work together efficiently and effectively. And I would like to say something about Dr. Garza's background. As Chief Medical Officer at SSM, he's responsible for quality, patient safety, and analytics for the SSM Health system. Before joining SSM Health, Dr. Garza was Associate Dean and Professor at St. Louis University College of Public Health and Social Justice. Previously, he served as Assistant Secretary and Chief Medical Officer to the U.S. Department of Homeland Security, an appointment he received from President Barack Obama. His work included Health, Medical, and Biodefense Authority for DHS, and he played a critical role in protecting the United States from threats of terrorism. Dr. Garza is also a colonel with over 20 years of service in the U.S. Army Reserves. He's a veteran of Operation Iraqi Freedom, and he has received numerous awards for his service, including the Bronze Star and the Combat Action Badge. Today, as we announce the St. Louis Metropolitan Pandemic Task Force, I'm proud to introduce Dr. Garza as the leader of this historic effort. A unified commitment will save lives. In St. Louis, one of the best healthcare systems in the country, bringing all of our talent together and helping us fight the surge that is coming. This is the most responsible and effective way to reduce its impact. Dr. Garza. Oh. I would shake your hand, but
yeah. Thank you. Good morning, everybody. So I have a couple of slides that I'm going to run through here. But first of all, I wanted to thank all of our elected officials for really, they've just been tremendous partners as we've come together as a healthcare system in helping us battle the pandemic. And all of the public health leaders as well. I mean, we've come together recently as a healthcare system, but these guys do the yeoman's work day in and day out with protecting the public. And so this is really a unique partnership for all of us. So today, really, BJC, SSM Health, Mercy, and St. Luke's are collaborating as the St. Louis Metropolitan Pandemic Task Force. And this will bring us all together, not as separate entities, but as one. I think we quickly came to realize that we needed a unified approach if we were going to get through this pandemic successfully. And we realized this was the best way to address all of our needs, whether that's personal protective equipment or facilities or ventilators, all of those different things. You know, normally healthcare is a very competitive business, but we recognize that this is an unprecedented time in our history. And this was a time for all of us to come together, not just as healthcare systems, but as a region, if we want to get through this. The data is really clear. The next couple of weeks, up to a month out, is going to be an extraordinary time, not just for us here in St. Louis, but across the nation, as the number of cases are going to surge. This is just math. We also know that this is a unique issue, not just in St. Louis, but across the country. The virus doesn't stop at geographic boundaries. It doesn't stop at zip codes or neighborhoods. It's going to affect everybody. And because of that, everybody has to play their part in how we decrease the spread and save lives. It's going to hit us hard, but really how hard it hits us is dependent upon us, not just in the medical care community, but as an entire community. And that's the really important message to take away from this. So we've come up with a very simple strategy, and that is really to stop the spread and save lives. These are interconnected ideas. If we can stop the spread, we will save more lives. Part of the saving lives is dependent upon the medical community, but really stopping the spread is a universal issue. It can't just be driven by healthcare. It can't be driven by government or by public health. This is everybody's responsibility. So when we took a look at this, we said, well, what are we wanting to occur from all of this? And it was simple. It was save as many lives as we can, establish the well-being of the community, stop the spread. And the reason for that is if we do all of those things correctly, we'll get to end state quicker. The community will be able to re-engage quicker. We'll be able to get economic recovery quicker. If we don't do those things right now, all of those things will be delayed. And that causes a problem not just for us, but for the entire area. So as you can see here, our desired end state was overall health and well-being with a substantial decrease in new transmissions and death, and that will lead to elimination of the shelter-in-place orders and reactivation of the local economy. This is a very popular slide that's been circulating around the internet. It's by a gentleman by the name of Thomas Pueyo, and it's called The Hammer and the Dance. And so if you look at the curves, you'll see on the purple curve is sort of where we are today. And it talks about two separate strategies. So one is a mitigation strategy and one is a suppression strategy. Because of the very bold decisions that were made by our public officials, we're not having to entertain that blue line. We're on the purple line right now. So I cannot stress enough how important it was for the aggressive actions to have occurred early to get us to where we are today. We've built models, some shared models that show where we think we are going to be going. We have seen some improvement in the numbers, but that should not dissuade anybody from what we're facing going forward. It's going to be very challenging. So the hammer piece that you see on the slide here is really all of the things that we're taking to date. Very restrictive social distancing, very aggressive hand washing, all of those things that really start to bring the numbers down. What we need to focus on going forward, in addition to what we're doing now, is how we do this going off into the future as well. If we relax standards, if we relax the social distancing, all of those other practices that we're doing, we will see an increase in cases. And so now is not the time to relax. In fact, it's the time to double down on the issues that on the things that we have been doing. So as we began organizing this as a healthcare system and then talking with our elected officials and bringing other people into the fold, we started talking about lines of effort. And so as a healthcare systems, we said these are the specific things that we need to be doing during different parts of the pandemic. And you see that broken out into different phases. And public health is doing the same things. They're continuing to look at what are some of the things that we need to be doing in order to be prepared for this pandemic and in order to save the most amount of lives and prevent spread. Same thing has to be happening in the community. As I said, the healthcare alone cannot do this. Public health alone can't do this. Elected officials alone can't do this. This has to be a shared responsibility of the community if we're going to get through this in as good a fashion as we can. So it's very simple. If you think about this as what is causing the disease is kept going through transmission. If you can interrupt transmission, then you will stop the spread and it'll save more lives. What is sometimes lost in the conversation is, in addition to all of those COVID patients that we take care of, we also take care of all of the other patients that walk through our doors. So people don't stop becoming sick just because of a pandemic. So in order for us to take care of the most amount of people the most effectively and save lives, we have to make sure that we're using our resources appropriately and preventing us from getting overwhelmed. There is a certain amount of capacity within the healthcare system, both overall in terms of beds in the intensive care unit and in terms of ventilators. And we want to make sure that we're maximally using those facilities, that equipment, and our staff so that we can save the most amount of lives, no matter if you're impacted by COVID or if you're not. So it's very simple. If we can decrease the spread, that means that's less patients we have to take care of in our facilities. That allows us to do the very best work that we can do within our hospitals, our intensive care unit. It also, quite frankly, alleviates stress on our staff. Our staff, we know, is very stressed right now. You've seen in the media as much as we have, all the anxiety going around about potential exposures and all of the other things. They're concerned about their families. So let's let them do their very best work as well. And it's not just healthcare workers, it's anybody that really serves the public or has to provide an essential function. So that could be anybody from a paramedic and firefighter to the person that works in the grocery store. If we do all of the things that we need to be doing as a community, including the social distancing, aggressive hand washing, social distancing, we're protecting them as well. So in summary, I just wanted to, again, really give my appreciation for my partners in healthcare who have just been extraordinary. I can't say enough about them, as well as the partnership with our elected officials and with our public health department. It has truly, truly been a collaborative effort. And I think this is just going to put us in a much better place going forward in how St. Louis is going to deal with the pandemic. As many of you know, St. Louis has a very proud history with dealing with pandemics. And in fact, when I was both going to school here at St. Louis University for public health and then teaching public health, one of the public health stories that is repeatedly told really across the nation is how St. Louis handled the 1918 influenza pandemic. and how because of when we were aggressive in doing social distancing, that we were able to come through that pandemic relatively unscathed. Now, relative is it's a creative term, but when you compare that to other cities that did not take aggressive measures, we were much better off. And so we have a very proud history of dealing with public health crises. And there is no reason why we cannot be that shining example again for the rest of the country. So again, I just want to thank everybody for their collaboration, for their cooperation, and I think we'd be happy to take any questions that people might have for the next little bit. Thank you.
As a result of the task force, are you able to now guarantee things like masks and personal protective gear for all of our nurses and our doctors in our area?
So yeah, let me talk a little bit about that. So as you know from looking at the media, PPE is a significant challenge. It just is, and I think my partners in healthcare would agree. My partners in public health would agree. There's a tremendous strain right now on the supply chain. We literally scour the earth looking for personal protective equipment, and when I say that, I am not kidding. We are looking in every nook and cranny to that. So how I will answer that, though, is we are following all the appropriate guidelines for personal protective equipment. It is paramount that we keep our healthcare workers safe. And so we're doing everything within our power and with our supply chains to supply them with all of the needed equipment that they have. But we also have to recognize that there is a tremendous constraint on that supply chain. There just is. And I wish I could make it go away. I wish I could tell you, yep, we have absolutely all the supplies that we need. It's a challenging environment. It just is. But do know this, we wake up each and every day concerned about where are we going to find PPE and how can we best protect our workforce. We've got a long haul, too. And part of that means we have to make sure that we're not just protecting our healthcare workers for today, but we're protecting them over the next month. And so a lot of that is led to, and I'm sure you've read about conservation techniques and some other things. So it's not just about how much PPE do I have today, it's how much do I have in the next month and how can I conserve while protecting the most amount of people.
About ensuring that there's adequate testing and also help if these people get sick throughout the entire metropolitan area extending into.
Yeah. So let me address testing first. I would put testing in almost the same bucket as personal protective equipment. Everybody wants testing, and there is limited supply. And so I'm sure you've heard again in the media about not enough testing being done. And that's true. We haven't done enough testing. And again, part of that is just a supply and demand issue. So we, again, the healthcare systems, public health, have literally been scouring across the country, really, to obtain more sampling kits, more testing kits, everything that we can. I know that our facility at SSM, BJC, we have ramped up production for testing. We've bought new machines so that we can increase capacity. But if you have to think about it almost as a manufacturing flow. We have to have enough raw material in order to do more testing. And if we can't get enough testing supplies, enough swabs, then there's no way that we can ramp up testing. And so that presents a lot of challenges to us. And then it also makes us think, well, who do we need to be testing? And so part of the discussion is, should we just test people where it's going to make a clinical difference instead of just testing everybody? Because we don't have enough test kits to test everybody. You compare that with other countries where there is much larger supply, like a South Korea or Singapore, where they're able to do really aggressive testing. It's just a different environment here. And so we have to allocate those resources much more precisely than that. It does present a challenge, though, when you're looking at what does the population look like? Like how many people are infected out in the population? And we're making some educated guesses about that. But until we get the increase in supplies, there's really no way that we can do that aggressive surveillance using testing. I'm sorry, what was the second part of your question?
So in terms of treatment as well.
Yes.
I can add to that question. So obviously you guys have several different healthcare organizations that are partnering in this. Logistically, how are you structuring this? Is there going to be sort of a triage?
Yeah.
One hospital does one function, one does another.
Right now, we're not looking at that because, and we recognize, and this is because of a couple of reasons. Patients can present asymptomatically, right? And so the concept of trying to create sort of a COVID hospital and then a clean hospital, in theory, that sounds great. In practicality, it doesn't really work. We know that we have had patients personally, and I'm sure that Mercy and BJC have experienced the same, that have come in to our facilities for other reasons that have then tested COVID positive, that we would not have expected upon entry into our hospitals. And so, although it's appealing to house all of them in one institution, and for all practical purposes, it's not. It just would be very difficult to do. Likewise, we know that we're going to have COVID patients show up to all of our institutions. And so what we have been doing sort of internally is cohorting patients so that we minimize exposure to staff. We can increase our negative pressure rooms to keep other people from getting infected. So anything that we can do to effectively treat the patients as well as effectively protect our employees internal to the hospitals, we are doing. So I hope that helps answer your question.
So are you all pooling resources, pooling PPE, ventilators?
Right. Right. So let me answer it to you this way. Each of us have our own supply chain. So we pull dependent upon what the need is at each of our facilities. We also have pulled together what the number of our ventilators and things like that look like. Right now, we're doing very good sort of as independent organizations about organizing our PPE. But we are in discussions about how can we best share and allocate resources. So particularly if one system was getting much more strained, how can we then shift and allocate resources to protect them? It does us no good if one of the other healthcare systems fails while we still have personal protective equipment or ventilators. But the key to that, so let me circle back around to that. We never want it to get that way, right? So we never want to be in a position where we feel like we're going to run out of personal protective equipment or ventilators or ICU space. And the way to do that is to decrease spread, right? And so if we can decrease spread, really that's the key. So we talk a lot about personal protective equipment and ventilators and ICU space because, it's very dramatic, right? The much more dramatic impact, though, is on all of those public health measures in decreasing spread. We never want to get to that spot where we think we're at risk of failure. Then we've lost. So we need to prevent us from getting there, and that's why it takes the entire community to do those sorts of things.
When do you anticipate a peak in Missouri? I know some of the projections from the White House have actually identified us as dead last in the nation, maybe late May. Look at Illinois, it's a lot sooner. Do you have any projections on that front? Is there a way to expedite that if it is a ways out?
Sure. So let me preface modeling. And this is an old statistician's quote, which is all models are wrong and some are useful, right? So there's many models floating out there. There's the model out of Washington. There's another model out of Harvard. And so you have to be really careful when you're trying to make predictions based on modeling. So there are a number of datelines floating out around there. The thing about models is they become much better as the pandemic progresses because you're more zeroing in. So think about it almost as like I liken it to the hurricane predictions. So they're very wide at the very end, but very narrow where the hurricane is. And healthcare projections and disease projection is no different. There's a huge degree of uncertainty that occurs because we're still fairly early in the pandemic. Now, from the models that we have been running, and when I say we, it's all of the large healthcare systems together with WashU and SLU, we believe that peak will happen anywhere from 2 to 3 weeks from today. If you look at the national models, so those are the state of Missouri. And so you have to understand that's like all comers in the state of Missouri. And so it's a much different, it's much different data than our very specific regional data. But that's what our best models are showing us. And again, that could all change, within a week. We ran the models last week. Numbers look different, dates look different. As we get more data into the model, it becomes more refined. We become more comfortable with what's coming out. But we always have to, when you think about this, we have to plan on what the worst case scenario is. Like, we don't want to be caught, not prepared. And so those are some of the assumptions that we have to work with. And right now, those are saying around 2 to 3 weeks out.
2 to 3 weeks for St. Louis, our metropolitan
Correct.
area, or the entire state of Missouri?
The metropolitan area, yeah.
Time for one more question. Where are you? Where are you on capacity right now as far as patients?
Yeah, we're doing pretty well on capacity right now. Certainly, it's stressed a little bit. We are treating a number of COVID patients, and a significant percentage of them are on ventilators right now. And so, again, you can't just think of it though as numbers, because those numbers expend an incredible amount of resources, right? From PPE to workforce exposure to all of those other things. And so any addition to all of that puts that much more strain on the healthcare system. But again, I'll circle that back around to the way that we get really good at this is to decrease the spread so we're not having to stress the system as much. That is key. Yes?
Any treatment, one treatment over anything else?
I'm assuming you're talking about medical treatment. Nothing has popped out that I know of. I keep my pulse on how things are going clinically. But Clay, I don't know if you've heard of anything significant. Clay is an infectious disease expert, which is why I'm pointing at him.
No, I don't think there have been major breakthroughs at this point. There are a number of treatments that have appeared in the press as preliminary that may be promising. In St. Louis, we'll start a multi-arm test actually this weekend to test some of the strategies that have been proposed, and hopefully we'll get some information from those studies.
That's the NIH. That's the NIH-funded study?
These are locally funded studies, so the universities and hospitals are footing the bill right now.
Yeah, I do think that it's a good point to stress, though, is we're really blessed to have some just top-notch academic facilities here that are going down multiple different paths to look for what could be optimal treatment for COVID patients. And so we're extremely blessed in St. Louis. Okay, thank you.